So, to answer to your questions, which I'm sure all of you would have on what is robotic surgery, how is it different from a traditional surgery, and is it a better outcome that we see after robotic surgery? Do we have to stay lesser time in the hospital? To answer all such questions, we have our esteemed panel of doctors who have the first-hand experience in robotic surgery. And to welcome them, firstly, I would welcome Dr. Rajshekhar Jaka, who is our consultant in surgical oncology department. He has 20 years of experience in the field of surgical oncology and has been certified by the European board. He is pioneer in starting many advanced cancer treatment in India like HIPEC and sentinel lymph node biopsy, MIRP, mediastinoscopy, etc. He also got trained in robotic surgery at Roosevelt Park Institute, New York in 2012 and has 10 years of experience and performed 400 and above robotic surgeries under his experience. And he also operated on the third robot in India, so which is a great achievement. And I welcome you to the panel, sir. And secondly, we have Dr. Deepak Kaddu. He is MCH in neurology, and he comes from a prestigious institute of KM Institute of Mumbai. And he owns a robotic fellowship under Botikuti Foundation and has performed 400 and above robotic surgeries, and also has a fellowship and has interest in robotic uro-oncology and kidney transplants. So I welcome you to the show, sir. And thirdly, we have Dr. Manjunath Haridas, who is our colorectal and upper GI consultant at Manipal Hospital Whitefield. He nearly has 2 decades of experience as a surgeon, and he's trained in UK and US and reputed institutes like Cleveland, USA, and also has a fellowship in robotic surgery from Atlanta, and has performed hundreds of surgeries when it comes to colon, small bowel, and stomach. He also has a vast experience in robotic abdominal wall reconstruction surgeries like hernia and complex GI surgeries. So I welcome all 3 of you to the panel's discussion, sir. And to start with, I just want to understand, like, what exactly is robotic surgery? And Dr. Jaka, if you can just respond on what exactly is robotic surgery?
See, basically, it's a tool which will help a surgeon to operate in a more precise way. It is not something which is pre-programmed. It is the surgeon who will be operating, but the transmitted movement of fingers, our surgeon fingers, will be replicated there. There will be a patient card which is near the patient. So we will not be near the patient. We will be little away, far away from the patient, but the transmitted movement will be carried there. The most important thing here is it is 10 times magnified view. So the chances of error or chances of injury to the surrounding structures is very minimal. And we have a 3-dimensional view that gives a depth perception. And moreover, the surgeon is at ease. So you don't have to bend and struggle and do it. So that is why more complex surgeries, difficult to reach areas like pelvic, thoracic, all those areas where even laparoscopy is so difficult to do. That can be done with ease. And the instruments are so far advanced, just like a human wrist, endo-wrist technology, what we say. So that is far superior compared to the laparoscopy. In that way, we will be able to do a, what you call a more precise surgery, bloodless, means less of blood loss and less pain. So in that way, there are many advantages of this. So it is not something which is pre-programmed. That is more important to understand. It is a surgeon who performs the surgery, but with lot of newer technology which will help in safeguarding the patient interest.
Absolutely. And how is it helping nowadays in treatment of cancer, sir? If you can just shed some light on how cancer and robotic, have a synergy between.
Yes, it has made a tremendous difference in the cancer treatment because, for example, pelvic surgeries. Previously, we used to do this rectal surgery and we used to struggle a lot with the laparoscopy or open surgery because it's a narrow space, particularly male pelvis and all that, difficult to see the nerves. And now you are sitting at ease and you are able to see all the structures because it's a magnified view. We are able to dissect even to the pelvic diaphragm, and below that sometimes intersphincteric. So lot of anatomy is redefined, I can say, because of this magnified beautiful view. We are able to have a better negative margin. We are able to go in depth. So in that way, cancer care means basically cancer care is when you want to remove the tumor completely with a negative margin. And the outcome should be either equal to laparoscopy or open or better than that. So that is achieved by this newer technology. In that way, I can say like pelvic surgeries, we have uterine cancer, endometrial or cervical cancer, rectal cancer, prostate or bladder cancer, and thoracic where there is a limited space to move the instruments. So esophagus and lung surgeries and mediastinal tumors can be done with far ease. That's a lot of advantage. Yeah, clearance is far more better. So it gives superior comfort, definitely.
Absolutely. And the next question to Dr. Deepak. How is robotics helping us to improve the surgeries when it comes to urinary tract or urology related?
So, per se now and in present scenario, the maximum number of robotic surgeries are done in the field of urology. So whether most of them are radical prostatectomy and partial nephrectomies. So it has helped in a very much big way, because in the prostate surgery, we are operating in the pelvic field, which is narrow, and we have to achieve many things like oncological safety margin. Second, we have to clear the lymph nodes. We should not damage the nerves and vessels for better continence and better outcome. So all those care is taken, and the suturing part has to be very easy and comfortable for the surgeon. So because of the magnified view, we can see many structures with clear cut in robotic and in a 3D vision. And second thing, the surgeon has a control of the camera. He has a control of the operating instrument and the assisting instrument. So there is no need of assistant much. He can himself. So, and the thing is, when suturing, the dexterity is so good. Just clicking the that clutch button, you can rotate 360 degree on you and go beyond. The suturing makes it far easy, and that gives the best result. So I would say, if you are driving a car, if your driver is at the comfort, you will get to the destination properly in safe and quick way and comfortable. So the driver is the surgeon. The surgeon is very comfortable in this position. So the second thing is the partial nephrectomy, in which previously we used to do radical nephrectomies. Now we have switched to the partial nephrectomy for the smaller kidney tumors. So in such cases, to get the proper safety, oncological safety margin, as well as to suture the remaining parenchyma and get to the pinpoint bleeders, so that the bleeding should not happen post-operatively. So that is the best done by robotic. There is no comparison to the other. So, and it can be reproducible by many people. It's not like the only one skillful surgeon can operate. It can be reproduced by many people. So it has definitely helped in urology.
So if anybody has tremors while performing surgery, all that is covered during robotics. And the next question is to Dr. Manjunath Haridas. So doctor, how is robotics used in gastrointestinal surgery especially, and what all surgeries do we do using robotics in gastrointestinal area?
So first of all, I think everybody knows that the robotics was started in terms of cancer surgery and pelvic surgeries. Now, in GI surgery, it actually started over a decade ago itself. After the cancer outcomes were better, urological surgeries became better, started to get involved into GI surgeries. And they've seen that the outcomes were even better or even closer to what we call as the laparoscopic surgeries. Patients were going home sooner, the blood loss was very minimal, and the pain perception was much lesser compared to even open surgery and sometimes some laparoscopic surgeries as well. As Dr. Kaddu pointed out, I mean, the suturing aspect of it is one of the key in terms of GI surgeries. That became an ease. And any surgeon who can actually perform really calmly and smoothly for about 6 to 8 hours, he's really comfortable. And at the end of the day, a comfortable surgeon will give you a very good outcome. And that is the thing that has changed the whole landmark about robotic surgery. The patient outcomes improved significantly, especially the time to go home, because the bowel function returned very quickly because of the minimal handling of the bowel tissues as well. Now, because of the visualization, the way that you handle bowel and the way that you move bowel becomes very easy and simple, as if nothing has happened. And as Dr. Jaka pointed out, the nerves, the structures that you see is magnified to an extent that you wouldn't even want to damage them. So that is how the magnification is when you do robotic surgery. And all of them put together, the patient is ultimately benefited. And that is what has changed right now. I think we have almost closer to a decade of GI surgery experience right now, and things have changed. Things have really changed for all those patients who actually require GI surgery. I think if anybody would want to go for surgery, I think the first step they should ask for is robotic surgery. And I think that is where we are at this moment in time.
Sure. And just wanted to know, like, is there any criteria that you select, like when a person opts for robotic surgery? Is there any set criteria that this age group or this kind of surgeries only can be done? So if you can just shed some light on that.
I think that's a very good question, because a lot of time, when the robotic surgery started off, it was actually dedicated only to cancer surgeries, difficult procedures, or difficult place to reach. And over a period of 5 years, that maturity has increased, and we have become more comfortable in actually performing even the smallest of any laparoscopic surgeries. So the amount of stress that you may undergo as a surgeon to do a simple surgery, especially suturing an abdominal wall, suturing a bowel, or suturing even a vein and artery, has become so simple. Now, if you really take one of the most difficult surgery is cardiac surgery or a mitral valve replacement, robotics has changed the landmark about that. In terms of mitral valve replacement surgery, there are people who can actually sew mitral valves in much more smoother way without any technical challenging difficulties. Now, that is how the robotics has changed. So if you imagine such difficult surgeries can become smooth, imagine a simple surgery. It will actually be better than what you can actually offer patients. And I think patients should realize this. Any surgery that can be done laparoscopically can be done robotically. That means to say that you are at an advantage. The patient themselves are at an advantage of getting the best outcome possible through a robotic surgery.
Sure. My next question is to Dr. Deepak. How do you think that robotic surgery has developed in terms of when it comes to urology? What are the recent developments that we have seen lately in terms of, especially when it comes to urology?
So you want to know regarding the recent developments, like the recent scope of robotics in urology. So I would like to point out that we have a lot of kidney transplants going on. Like most of the kidney transplant is the best treatment for any patient with chronic kidney disease who is on dialysis, whether peritoneal or hemodialysis. So for them, there are options. Most of the people, like more than 90 to 95% cases of the kidney transplant are done by open way. So there are many pitfalls of that open surgery, like when you get a right kidney, the vessel is small, so suturing becomes difficult. When you are operating in already operated patient of kidney transplant, then it becomes difficult. If your assistance is not good, then it is again difficult. So the robotic assisted kidney transplant is coming in a big way. So I would like, India is the leader in robotic assisted kidney transplant. So there are 3 centers in India, which is the top kidney transplant centers in the world, who are doing robotic assisted kidney transplant, like more than 800, more than 600, and more than 300 cases. So the robotic assisted kidney transplant, how it helps. So as Jaka sir pointed out, the vision is 10 to 12 times magnified with 3D vision. So that gives a clear-cut way of easier vascular suturing. So because in the kidney transplant, the vessel suturing is the most important part. If you miss any of the gap is there between the suture, then bleeding starts, then you have to clamp again, then the results are compromised. So in the robotic, the suturing is so perfect, so uniform. So there is no bleeding and no reclamping, and the results are far better. The second thing is, as both of them have pointed out, the cosmesis. So in the kidney transplant, robotic assisted, our incision is below the belt line. It's a very 6 centimeter small incision. So after the surgery, patient may not feel that the surgery has been done. Even after the surgery, the pain is so less. We measure it by visual analog scale. The pain is so less as compared to the open, because it is a muscle splitting incision, whereas the muscle cutting incision in the open transplant. And even, so the third benefit is the pain. The pain is very less. And so pain is less, cosmos is good, so there is an earlier recovery. And the fourth thing is many times the patients are carrying the drain for a longer time in open kidney transplant. So that's not there. That the drain is removed on the first or second post-operative day in a robotic-assisted kidney transplant. And slowly, even in Bangalore, people are getting into the robotic-assisted kidney transplant. The only problem about the robotic-assisted kidney transplant is people are not used to it. People are used to just conventional way of driving. So once they get used to it, they will find how good it is. So once they find that is a better thing, then they will slowly switch over. And unless until you operate it again and again, you won't know the nuances of the things, how to handle the complications, where to go for an open conversion, and when to just wait and watch. So the robotic assisted kidney transplant is coming in a big way.
Sure. I think, most of the people nowadays do not know exactly what are the advantages of using robots, and that's why they still opt for traditional. And I think this is the big way of, telling them that this is the time that they should opt for, because the post-surgical complications are highly reduced when it comes to robotics. Right? My next question is to Dr. Jaka. So you told us about different cancers that we treat using robotics. Can you tell us, are there some cancers which are not treatable when it comes to robotics, and how is it developing in big way when it comes to surgical oncology?
All cancers are not that we are going to treat with robotics. It is basically the cavity. There should be a cavity to operate, because this is done, for example, in the abdomen or in the thorax. There is a larger cavity where we can see it. But some subcutaneous tissues also we operate, like, for example, thyroid surgery, that is for the cosmetic reason.
Right.
For example, cancer of the breast. We cannot, means we don't offer robotic surgery because it doesn't have any more advantages, because it is a surface tumor.
Right.
Like that, majority of the surface tumors we don't do robotic surgery. It is only when the tumor is inside the body cavity, it is more preferable. Soft tissue sarcomas, which may be on the leg, limb, upper limb or lower limb, we don't do with the robotic. Or some blood cancers, obviously there is no role of surgery, it is mainly chemotherapy. So these are the areas where robotic surgery is not used. So it doesn't mean that, it's a newer technology, it doesn't mean that we use it for everything. Where it has got an advantage, definitely we use it. Difficult to reach areas like throat, recurrence of a cancer in the throat, larynx, all these areas previously we used to cut open and do it. Now we don't do that. We just use a robotic TORS, we say a transoral robotic surgery. So we go there and remove the tumor. Like the difficult to access areas, all are done by now robotic surgeries. That's a big advantage.
Sure. And does it even lessen the duration of surgery when we use robotics? Just wanting to understand about that.
I don't think it lessens the duration. It all depends on the surgeon who is operating. Initially, there will be learning curve. It is, means it has got a lot of advantage, technical advantages. So that is how the other factors comes down. Like hospital stay will come down, blood loss will come down, pain will come down. All these are advantages of a robotic surgery. It is not as such the duration of surgery. It is the duration of hospital stay or other parameters which will be far superior in robotic surgery.
Sure. And what do you think is the way forward when it comes to surgical oncology and robotic surgery?
I feel there is a tremendous opportunity which we are foreseeing. Previously when we started, I operated right from now we have a fourth generation. I operated from first generation to fourth generation robot, and there was a tremendous improvement. Previously the arms were so big they used to clash with each other. Now things have changed and we are moving towards single port, and we never had staplers. Now we have robotic stapler, we have robotic harmonic, and we have Firefly technology where we can detect where is the vessel, where is the blood vessel, where the blood is flowing, where the ureter is there, urine is flowing, so that we can avoid the damage to that. And 3D image technology is being imprinted on this surgery. So we know how much to cut and all that. In future, probably what I feel is it will come with a microscope, it will come with an ultrasound machine at the tip of that, so that we know where the tumor ends, where to cut this tumor, so that we don't have to send it for a lab to assess the margin status. Probably in future it will be a tele-robotic, means you will be sitting here in Bangalore and operating in New York, or you will be sitting here and operating in any remotest of the village and giving service to a poorest of the poor patient, because cost is a relative factor. Over a period of time, this technology becomes cheaper and cheaper, and anyone and everyone will be able to afford it. Then once the tele-robotic comes into practice, I think any surgeon in the world can operate on any patient. Patient can choose like the best of best surgeon to get it operated. So it is going to make a revolution in another probably 15-20 years. Things will totally change.
So basically, complete occupancy of artificial intelligence
Yes,
into
yes,
human
yes, yes,
scenario.
yes. Because when we started, we never had this recording of our this one. They had recorded only to see if there is any mistakes or how many times we are using clutches and all that. So how we can improvise on that. But now all our simple surgeries are being fed into the artificial intelligence, and probably over a period of time we don't know how driverless cars have come. For minimal basic surgeries, even surgeonless things may come. So it has come to such an extent. Surgeon is definitely required, but definitely I foresee that in future even these things can happen, because when we can launch our rockets to Mars and all other planets with so much of precision, even this is also possible, that with so much of precision we will be able to operate and safeguard the interest of patient.
Wonderful.
Yeah.
Wonderful to know that, the technology is advancing
It is
so
really
vastly.
mind blowing. You can't imagine what can happen in future. So many things are happening, so much of research is going on. It's really, we will see a great difference in patient care in another 15 years. Yeah.
Sure. Thank you so much.
Yeah.
My next question is to Dr. Manjunath Haridas. So the other day I was just talking to my neighbor about how artificial intelligence is coming up in big way, and he was telling me that his uncle is down with hernia and was prescribed for a hernia surgery. So my doubt is, like, for small cases, like we have heard that robotics helps in big way when it comes to complex surgeries, but when it comes to basic surgeries like lap chole or hernia, how does robotic help? Does robotic actually help in recovery faster?
I think this is a very important question. If you actually look at the way the robotic has changed the landscape of surgery, it has come down to the simplest of the simple surgeries. So hernia surgery itself has changed vastly in terms of a hernia, how it is addressed. You have hernia societies, you have actually abdominal wall reconstruction societies. When you actually have a society, you already understand how complex a hernia dynamics is. A lot of people don't understand that. So laparoscopy was pretty good in terms of hernia surgeries, but I think the robotic gives you one more level of much more better outcome. Here in robotic surgery, you're able to actually put the midline back to normal, in the sense patients who have a hernia feel that there is a gap. And that gap is usually in laparoscopy is very technically challenging to close. As Dr. Kadu pointed out, the suturing skills are very brilliant in terms of robotic surgery. When the precision with which you can suture not only the intestines, the blood vessels, or even the abdominal wall is very good. And that gives you the best outcome. Say for a young person who has an abdominal wall hernia, he feels a gap. Now if he undergoes a robotic surgery, the gap is closed. And not only that, the mesh that we use in a robotic surgery is simplest of simple, and it is less costly as well. So if you look at the cost perspective, over a long period of time, it is much more beneficial to the patient. So what I would say to any patients who's actually listening to this, don't restrict yourself whether it can be done or whether it cannot be done. That is our responsibility. Now, if you have something that needs to be done, I would say in Manipal Whitefield, we have this new technology, which is the robotic, and just inquire. The moment you talk about robotics, we are there to help you. Now we are able to offer you that kind of surgeries and the latest of the innovations that is possible for the population that is there in the Whitefield Hospital. Now that will give you a better and most better outcome in terms of recovery. Now all these innovations, what Dr. Jakka was pointing out in terms of the future, all this is being dedicated to make sure the patient gets the benefit. Ultimately it is that. So the patient has to do well. Patient has to get back to his normal life. Patient has to have a best outcome after the disease has been cured by surgery. And that is where robotics gives you that one step more than what laparoscopy can give. Definitely, it's far, far ahead than the open surgery's benefits. So the robotics is going to be the new thing, I would say, for any kind of surgery. If it is a laparoscopic surgery, yes, any kind of laparoscopic surgery can be handled via robotic surgery too. So any patients looking for any robotic surgery, I'm sure we here at the Manipal Whitefield will have a dedicated helpline which they can just call and say, "Hey, you know what, I'm looking for this surgery." And we will be there to help them. And that is the dedication that the Manipal Hospital will probably provide from the Department of Gastro Sciences as well. So we all are very excited about this being here, and I'm pretty much sure the patients in this community will be able to use us to make them better. And that is what we are looking forward for.
Right. And like especially when it comes to surgeries in female, they are more worried about the scar formation after the surgery is done, especially in colorectal area and on the abdominal wall. So will it give a better result in terms of scar forming as well?
Yes, yes. The laparoscopy itself has given you an extra benefit in terms of the scars. But the placement of the scars has become improved considerably. As Dr. Kaddu was pointing out, we are able to hide the scars. And the scars are much more minimal than what the laparoscopy gives you. So any young patient, I mean, that is the beauty of doing minimally invasive surgery. If you consider laparoscopy as minimally invasive surgery, I would say minimally invasive advanced surgery is going to be the robotic surgery. And that is going to be the future of all the surgeries from now on, I would say.
Right. So ladies and gentlemen and uncles and aunties, so if you're looking for any hernia surgery, please don't opt for traditional methods only. We have robotics in place. So please do come forward to use robotics much more than the traditional methods. So my next question is to Dr. Kaddu. Dr. Kaddu, what do you think is the way forward when it comes to specific to urology and kidney transplants? That since we touched that topic of kidney transplant, can we do a kidney transplant using robotics at Manipal Hospital Whitefield? Are we like?
Yeah, the robotic assisted kidney transplant, as it is thought, it is very difficult and the learning curve is very much, it's not like that. It's actually far easier than the open transplant. There is no crowding of 4 or 5 people assisting, pulling one thread, following the thread. There is no requirement of those things. And the suturing is, as both of them had told, Haridas and Jaka sir, the suturing is very precise and very uniform, which is the most important thing in vascular suturing, because the vascular suturing is the most important thing in a kidney transplant. If that is compromised, your functional outcomes are compromised. So that is the best thing in robotic assisted kidney transplant. Regarding the other things, how we should put the kidney inside, how we should place the ports, and how we should do the suturing, that takes a small bit of learning curve. The learning curve is very less as compared to the laparoscopy. The robotic has very less learning curve, so it is very beneficial to provide so many mass numbers of doctors coming up in India. So it will be easy to learn fast and then pass on to the next generation. So the learning curve is pretty easy. It is not difficult. Only thing we should start doing. And the third thing Jaka sir pointed out, there is a Firefly technology in which you can see the blood vessel, whether whatever anastomosis you have done, whether it is supplying the kidney. So kidney vascularity is there. So even it can decrease your use of Doppler and wasting the time of shifting the Doppler. So Firefly technology can be useful knowing the vascularity of the kidney after the anastomosis. Even in partial nephrectomies, like after clamping the vessels, whether that clamp vessel is supplying the tumor or whether there is any other vessel, that can be known by the Firefly technology. So it has a lot of advantages. Slowly it will take time. Like previously, also want to point out 2-3 other things, like if you want to go from Mumbai to Bangalore to Mumbai, it will take 10 hours by train, and flight it takes just 1 hour, 1.5 hours. So that is the advantage of robotic. The time is shortened, but the only problem is like docking and undocking. Like you waste time in your checkouts and check-in, that time will be wasted some time, but still it will be quicker in robotic. Depends on person to person, and after the learning curve is overcome. But certainly it has advantages. The second thing, like sir was telling, it is not accessible to the surface places. So like that only, it has certain advantages, so it has certain disadvantages. So the instruments are so huge and they are so bulky, so it can be reached where there isn't perfect cavity for the movement of the instrument. So for an advanced cancer which is stuck to all the organs, the robotic surgery has limitations. So we can't go. We have to go for open, not even laparoscopy. So like your aeroplane can go from Mumbai to Bangalore, but reaching a small place anywhere inside the jungle is not possible by plane. You have to go by helicopter, or you have to take in some other locomotive. So it has certain advantages which can quicken the surgery. The third thing I would like to point out, the main hindrance for the robotic we face here is the amount. So amount is, people think it's very costly. So as we were discussing yesterday in the insurance section, meeting with the insurance people and the billing, so the amount is not that much. It is just around 20 to 30% extra, around like if it is costing 3.1 here, it is in robotic, it will be costing 2.4 in the laparoscopic. So just for 70 to 80,000, the outcomes are excellent. So whether it is an oncological safety margin, better outcomes in terms of continence rate in robotic prostatectomy, or if you are doing even benign surgeries like pyeloplasty, the suturing is so uniform, the outcome is guaranteed, which we can't 100% guarantee in laparoscopy. So the outcomes are guaranteed. The only thing, as the network of robotic goes on, the more and more companies start coming in the market, the robotic cost will go down. And at present in USA, maximum number of surgeries, intra-abdominal surgeries are done by robotic. And the time is no longer, it will come to India. The India will be the most leader in the part of the robotic surgery because we have a huge population. We are already ahead of Europe in terms of robotic surgeries, and soon we will be ahead of America in terms of robotic. And I don't think even 15, 20 years, you will be seeing people coming from America and Europe for medical tourism, like lesser cost and so much of work experience. People will be coming for fellowship as well. So I think it has a huge future for the robotic, even in terms of medical tourism, and cost will come down, and even the insurance sections are getting used to this robotic surgery. They are including the robotic surgeries. The people will always ask for the robotic. They will not go for laparoscopy or open surgery.
Wonderful to know. And my next question, Dr. Jaka, is to you. We have heard about prostate cancers a lot, especially in males. It's like dominating in terms of cancer, right? So is there a better outcome when we treat robotic prostate cancer with robotics?
See, prostate as such, he can answer, but as such, all the cancer treatments, because the margin clearance is better, blood loss is less, definitely outcome is better because we are able to achieve this goal. What is the goal in a cancer surgery is patients should survive for a longer time. We should give higher cure rate and recovery should be quick. That is all is achieved through this. And because patient is getting discharged early, definitely the cost is less. Final cost is definitely less in comparison to all other formats of surgery. So in that way, definitely it is more advantageous.
And the prognosis per se also it is better?
Yes, yes. When I say survival, it is a prognosis because prognosis in the sense any cancer patient, we talk in terms of survival. How long they are going to live after this surgery. Definitely, because when you have cleared the cancer, you can see with such accuracy, then you are more likely to remove the complete tumor. So better chances of survival, definitely. So dissections are really amazing. Collateral damage is very less. So definitely superior outcome.
Sure.
I'll just take a few words about the costing. My perspective is a little bit different when you consider cost of surgery. I think one of the most important investment that you can make is on yourself.
Absolutely.
And the outcome that you make is going to be a very, very long term. So why would you want to invest on yourself in a cheaper way is my take. Now, long term, you're going to be doing much more better. And the cost balance will always happen. You may buy a car today which is expensive. That's going to depreciate. But today you have an oncological surgery done by robotics and you paid 20% extra. You know what? That's going to give you years. And in that sense, I think whatever is the investment, you should look at it like you're investing in your own health. And that is the best investment that never depreciates, that can only get better. That is the way that I think patients should actually look at their own health. When we have this new technology and a new innovation that is there in Manipal Whitefield, I hope patients just ask for the robotic surgery rather than looking at the cost, because we are here to provide that. Now we are not here to provide, and that is an investment that they are making them better for the next few years that may come in. And I think that way people should never look at the cost when they invest themselves into the healthcare sector. That's just my
Very
understanding
rightly
about
said,
it.
very rightly said. I think investing on you is something that everybody is earning here for, right? Like, if you can't invest on yourself, then why are you earning for then?
We have the opportunity here right now, so I think people should make use of that.
Absolutely. And Dr. Deepak, if you can just tell us about a little more to our viewers about in terms of robotics, how is it more advantageous when it comes to, I understand there are different advantages, but
Yeah, first of all, thanks to Manipal Hospital Whitefield for bringing Da Vinci robot so early and making us more competent, giving the best services to the patient. And in terms of like comparison, robotic versus conventional laparoscopic or open falls apart. There is no comparison. We are comparing laparoscopic versus robotic. So as Jaka sir has pointed out, there are certain advantages, like many advantages. One is the vision, in which laparoscopy is just 2 to 3 times magnification. Here it is 10 to 12 times magnified in the robotic. So then comes the dexterity, which is the most important thing for suturing and handling the and assisting, retracting. So the dexterity is excellent in robotic. Like you can just press the clutch button and you can rotate from 360 degree to 720 degree as till the instrument gets rotated itself. So it has very much advantages. Then the precision which you operate, the control is excellent. Like you retract it, it will be retracted for the time you want. Like the assistant is now feeling shoulder traction, his ergonomics are good, not good. So he will leave the retraction, then the surgeon will struggle to operate. Those things are not there. And everything is under surgeon's control. So if he has to blame for any wrong thing, he has to blame himself. And if he has to prove anything like he's good, that he has to prove himself. Like he can retract, he can move the camera, he can rotate, he can operate, means operating instrument, assisting instrument, everything is under surgeon's control with the foot pedal buttons and the hand control buttons and the clutch buttons. Then the blood loss and the pain and the cosmesis, those things are always there, but it is still far superior as compared to the laparoscopy. Because the way the robotic instrument moves and the way the laparoscopy instrument moves, it is a huge difference, and that causes a lot of pain and scar. So the scar is very cosmetic and less. Pain is less, so there is an earlier recovery, and blood loss is minimal. Like we were comparing the robotic versus open kidney transplant, where it goes on 300, 500 ml for an open, it goes just 30, 40 ml for the robotic kidney. So it is almost 10 times less. So better patient, better doctor surgeon comfort, better outcomes for the surgeons, patients. So robot has always an advantage over laparoscopy and other ways.
sure, thank you.
I always say a robotic surgeon becomes a superhuman because you have 4 arms at your disposal. With 2 arms, you want to do something and you ask your assistant to retract that, and you ask your assistant to hold the camera properly and all that. Now you have everything at your disposal. You have become a little superhuman now. You control the camera, stabilize it, you retract it, stabilize it, and then you operate. So it gives a lot of better clarity, and you are able to produce a better result. So ultimately, patient is benefited. Definitely, it's means advantage is amazing.
So your take-home point for all the viewers would be go for robotics, because I still see that there is a lot of fear when it is associated with cancer, right? So what would you say to our viewers to ensure that, you know, to be at ease and then come to us?
Yes. Don't have the fear that robotic surgery is something pre-programmed or this one and something may go wrong. You will have some complications. It's never like that. It's always surgeon controlled. Surgeon is performing the surgery. There are no chances of error, means machinery error here. It's always a surgeon who does the surgery. And because of this technology which is helping us, we will be able to perform a better surgery and give better results. So definitely, if there is a choice to opt within open laparoscopy or robotic, definitely there is no doubt, blindly I can say it is the robotic surgery. And fortunately, we have it here in Manipal Whitefield, so we should opt for it.
Sure. Dr. Manjana, do you also have any take-home points for our viewers?
No, definitely, as Dr. Jaka pointed out, I mean, don't even think about the cost. The first step, if you have any surgery that you require, I mean, we are happy to help you. We can start from robotics. If robotics is something that you really need and you're very comfortable with, we are very comfortable in offering that services out here, and that is something that you should take. And if there is something that you feel uncomfortable and you want to go to conventional type, and we are already leaders in doing conventional surgeries. I mean, Manipal has a very good reputation in terms of offering those kind of surgeries. Those kind of surgeries will remain forever. But the new technologies where we are actually pioneers in the new technology itself, you heard Dr. Jaka, he's operated on 4 generations. I now no longer feel old now. So I just have a decade of robotics, so that is more than enough, I think. So going forward, I think with the newer technologies, we are able to offer these out here, and that is what patients should take advantage of. And all these providing the new technology services, new people who are trained, people who are actually trained abroad, and we at Manipal Whitefield have excellent number of people who have trained abroad and they have come to provide services out here. I mean, that could not be possible without the expectations of the Manipal Whitefield population itself. And I hope the community out here understands that and appreciates what we have brought in here for them and uses the services to the fullest extent. And going forward, I'm pretty much sure Manipal will provide a dedicated helpline so that we can actually help those individuals, that they can just pick up a phone and just call, and there is one single point person that they can get reached to and help them get their queries answered. So we are very excited. I mean, at least from the Department of Gastrosciences, I think we all are pumped up about trying to provide these services to them so they can use, not only for the complex ones, even the simplest of the simple. You just need to inquire. And if we are willing to provide it, I would say just take it, because that will be the best option for you to get it done robotically here.
Sure. So just to summarize, like shorter recovery time, less pain, less blood loss, less scarring, and much more advantages and faster discharge to home. Right? So gone are the days when we used traditional methods of surgery, and we are back in action with robotic surgery at Manipal Hospital Whitefield. So in case if you still have any queries related to robotic surgery, please do dial on 951 31 66538. This is our dedicated helpline number for robotic surgery. So please get your questions answered on this number. Thank you so much. Take care. Thank you so much, Pam.
Thank you.
Is it closed?